Good evening. Tonight, we confront a harrowing new escalation in the Middle East conflict. An Israeli airstrike has struck the Al-Shifa hospital complex in Gaza City, killing at least 15 people. Among them are medical staff, patients, and journalists, individuals who were seeking safety or bearing witness to the war. Let me paint a picture. The strike hit in the early evening, just as the hospital was bustling with families visiting loved ones and staff tending to the wounded from previous attacks. The result? Chaos. First responders are still combing through the rubble, and sadly, the death toll is expected to rise. Two journalists with the Palestinian press agency were reporting live from the scene when the blast occurred.
صحفيين
Now you might be asking, why target a hospital? Or, more precisely, why has this tragedy unfolded in a place globally recognized as a sanctuary? In technical terms, the principle of medical neutrality, a cornerstone of international humanitarian law, should protect hospitals and staff from the violence of war. But in this conflict, even these lines are being crossed. The world is watching in shock. And tonight, the first images from Al-Shifa reveal not just physical devastation, but a deep assault on the rules that are supposed to keep wars human. Now, let's dig into the heart of the controversy. Why did this strike happen? The Israeli military has confirmed the airstrike, stating they were targeting what they allege was a Hamas command center hidden in a tunnel complex beneath the hospital. This is what's known as dual-use infrastructure, when civilian sites are said to be exploited for military advantage. But pause for a moment. Health officials in Gaza have vehemently denied these claims, insisting the hospital was filled with civilians and running desperately low on supplies. They've labeled the incident a massacre and are calling for immediate international investigation. Here's where the legal principle of proportionality comes in a term, meaning any military action must not cause excessive harm to civilians compared to the anticipated military gain. So, let me ask you, can the existence of an alleged tunnel justify the deaths of patients, doctors, and reporters? The United Nations Secretary General is horrified. The Red Cross calls it a dark day for humanity, and calls for accountability are echoing worldwide. Imagine being a doctor inside that hospital, forced to choose between staying to help or fleeing for your own survival. The conflict between military claims and human cost has never been more acute, and tonight, the world is demanding answers, not just explanations.